a group of people, separating a group of people into two groups. We have a particular group being divided into two. One of this group will now maybe come out as a positive result. The second group definitely will be negative, since it is just two groups that we are going to have from the parent group. So now, health screening, meaning that the whole population of people, we are trying to divide them into two groups, which are the group that are unlikely, or the group that is not likely to develop a particular health condition. Whereas the second group will be the group of people that are likely to develop a particular health condition. So that means different health conditions can have different screening. Take, for example, every one of us here, we can decide to do screening for us. And this screening can divide us into the group of people that are not likely to develop diabetes. The second group of people will be the group of people that are likely to develop diabetes. So that is screening. That is what we are going to be discussing. Now, there are few characteristics of a very good screening method. When you are applying a screening method to a particular thing, some of these things should be applicable so that it will be beneficial. When you are screening a particular condition, it should be a condition that is common, very common. Now, things like lupus is not that common, so we cannot say, let's screen everybody. Of what benefit is that going to be when you may not even pick anybody? But if you look at diabetes, we can say, let's screen people for diabetes because we know the importance and it's quite common, so that we'll be able to know people that could develop diabetes, so that over time, we tell them what to do in order not to develop it. They have not developed it. We are just screening to know if they could develop this condition, so that we can let them know on time, they can appropriately take measures to prevent it. So now I'm going to be discussing some of the health conditions in women and some in the male, as I know that we have both gender in the audience here. So now for the female, self-breast examination. Self-breast examination is something that one way or the other, we might have heard about it. I'm not sure if we have been doing it, but it's something that is so basic, it's so rudimentary, and it's so simple that we should inculcate into our style, into our lifestyle. We should learn to do self-breast examination. Why? Why is this related to the topic at hand? The reason is, if a parent is very fine, I'm very sure that the development of the child will also be very good, because you have all time to attend to the kids' development, growth, education, and overall, the development will be very fine. So that is why you have to be healthy for those children. We have to be healthy for them. So when we do self-breast exam, breast cancer is a very common condition. In fact, it's about the commonest, is it like the second most common cancer in women. So that means you can screen by doing self-breast examination. And whenever you are opportuned to be, you have the opportunity of meeting like health professional, they can also examine you, maybe once in a year. But yourself, you should learn to do your self-breast examination, which is usually done once in a month to pick if there is any lump, any skin discoloration, any ulceration, which is sore, or even a difference in the shape or the appearance of the breast.
The problem we usually have with the doctors are the terms. All this simulation.
No.
Some of us.
No. When I mentioned Ulceration, I said sore.
Okay. Ulceration
Everybody
means
knows
sore.
sore, like
Sore.
sore,
Yeah.
sore. Ulcer means sore, egbo, like a
Yeah.
wound.
Yeah.
Yeah. Okay,
That's
then
SORE, yeah.
skin changes. You have a particular color before, you discover there is a discoloration. There's a change in the color. There's change in shape, the change in appearance. These are just English terms, sir.
Yeah.
So now we look out for all these once in a month to know if there is, and of course, everybody knows what a lump is. Cocoa,
Yeah.
lump. So these are things that you look out for to know. So today, a task is that you should go out, let's read, let's view, or search for how to do self-breast examination, and let us implement this. So that's that. Another important thing, because of our time, is the pap smear, Papa Nicola smear, pap, PAP, pap smear, which is the screening for cervical cancer. Cervix is the mouth of the womb. That is where the doctors, the midwife, that's where they check during labor to know how gone the woman is in labor. Like the 2 cm, 3 cm they normally talk about. So that's the mouth of the womb, the cervix. So it's another common site that cancer occurs in the body of women. So because of this, it is also screenable. You can actually screen for cervical cancer to know. In fact, this particular cervical cancer, when you screen for it, you can have an idea the group of people that could develop cervical cancer, even in the next 15, 20 years. So I think we can know the importance of doing the screening. And this screening is readily available, it's cheap at various health centers. So we go there, we ask about Papa Nicola smear, PAP in short, pap smear. So that we can know our status. When we are healthy, we are not absent from the kids. Illness is not taking us away from them. And of course, prevention is cheaper and better than cure. So because of this, you also, when you are able to inculcate some basic things into your lifestyle, it will not be difficult for you to tell those kids that these things are basic things that you should do for yourself. They will know that since my parents do this, they should be able to also, they will know what is right. They will not be in the group of people that will be like, there's a breast cancer does not exist, this does not exist, when actually those things are actually with us. Now, another thing that is very important is that for the males, let me talk about the males. Now, this thing is not even very common. A lot of people do not take cognizance of it. Testicular examination is very, very important. Testicles. Males should learn to examine their testicles. You should.
Sorry, excuse me. Are you still listening to her? I can't see you type in the chat box as you did during my session. Please type in the chat box so I know you. I can hear her and she's making a lot of sense as usual, but I want you to type following good. Continue, doctor.
All right, thank you. Thank you, sir.
And
okay, now
spell. I'm sorry. Spell those terms. Okay, spell. Pap smear, ulceration, start spelling. Continue.
Okay. I will do this.
No, not you. It's us for them. Continue.
All right, so that
not you. Yeah. Continue, just to keep them engaged. Yeah. To be sure they follow.
All right, thank you. Yeah. All right, testicular examination. Now, there will be you see people having pain in their testicles and they will never say it out. And at the end of the day, the pain will subside over time. But behold, the damage would have been done. Damage is already done. And this is something that can affect the overall system. So because of this, whenever you have, like, even once in every 6 months, it's good that you just check by just handling it to observe if there's any abnormality. And of course, you must have been very familiar with the way the shape is, and over time, you'll be able to know a difference. So because of this, you examine, is there any lump? Is there any part that is hard? Or is there any pain? So that you can even go to the hospital, they can check for you. When at the hospital, they tell you everything is fine, you can go, then, alhamdulillah. Unlike when you just leave it and lo and behold, the next time they are picking anything is testicular cancer. Another thing is the issue of prostate cancer. Prostate cancer is something that is also very common and is actually treatable, especially when picked early. So because of these two reasons, you can screen it, you can treat it, and it's so cheap. Why not look out for it? Even while believing that you can't have it, you can look out for it. Anybody,
yes,
any male.
Some of us have the belief that it's when you look out for those things that you then have those things. HIV test. When you go for the test, you're going to have it. So people don't. So what do you think about those people? What is the advice for those people?
The reason is very simple. You know why? It is what you look out for that you will see. Take, for example, before now, they will say, like, in the olden days, our parents then, you didn't normally have this, our grandparents. Who says that at the past time like that, there were no machines, there were no sophisticated instruments to look out for those things.
So even when they happened, they don't know that's what is wrong.
Sickle cell disease is a very good example. You will see a lot of people, they will be like, they have been having abiku.
Abiku, Ogbanje in Igbo.
Yeah, but over time, with the advent of better screening method, they discovered that these people that they have been termed Ogbanje, Abiku, and co, they discovered they have a particular abnormality, and they discovered that the kind of blood that they have is quite different from other people. So maybe some people in the past would have died of cancer, maybe breast cancer. They would be like, they were stoned, like Otangolofa. I don't really know.
Yes. That's relatable.
Skin cancer, things like that. Some people, a lot of things like that, cough. People will be coughing, they will be like a particular thing. Maybe it was just tuberculosis. Maybe it was just asthma. They are not looking for it. The truth of the matter is, I was reading a particular write-up of a doctor. The doctor, I think the age of the doctor as at then was like 70-something years. During his lifetime, he had almost 7 cancers. 7 cancers, if not more than that.
Oh.
The first one, 7 cancers, and he survived every one of them. The first one was about the age of 21. It was just a routine check. He picked a particular thing. Lo and behold, he went for further evaluation. They discovered that it was cancer. Like 10, 15 years after,
I'm listening.
They picked another thing. They picked another thing. So if that person was not checking, I'm sure that he wouldn't have lived to the extent of picking up to 7, because he would have died at the level of the first or the second one.
Exactly. 7.
He was cured. He was treated, he was cured.
Because he asked questions, yeah. And he discovered them early.
Another very good example is the HIV. HIV is different from AIDS.
AIDS, yeah.
When you refuse to be screened for HIV, that means you are writing an invitation letter to AIDS. And AIDS is the one that is deadly. HIV is not deadly. HIV is just like malaria in you, not having symptoms. Unlike when you now start having symptoms of malaria. So screening has a very, because
there is an example here. There's a fantastic and classical example here that I would like to read. Okay. My mom died of cancer. We were novice. We did not know about it. Even though the lumps were discovered early, we believed it was offer.
Okay.
They believed it was offer, and before they actually knew, things had already gone bad.
With our society, we believe in other alternative mode of treatment. They'll be like, well, that's that. Yeah. So we learn to employ
Are there some diseases like the ones you mentioned? Can they be cured with the natural medicine, the herbs and so on? Is it possible for them to be cured?
Well, there has been a lot of like people saying that you can use this, you can use this. I'm not sure if any of them can actually bring proof of effectiveness, but definitely even some of these chemotherapeutic drugs, chemo, most of us will be familiar with that, chemo. Even simple drugs that we use, anti-malaria, paracetamol, some of them are made from natural sources. So one may not be able to say outrightly that some of these natural things may not work. Okay. But the issues that we normally have against them include the fact that they keep saying that there is no side effect to some of these drugs. Some of them. There's nothing in this life that has no side effect. There's nothing in this life. The fact that we sleep and wake up, or better still, we go to bed, the side effect could be that one may not even wake up. You wake up today,
nothing happened to him, he just slept and...
Why not be awake and not go to bed so that you will not die? Someone crossed the road, the person was hit by a trailer, the person died. Once another person cross that road, another person will cross now.
Oh, yeah, awesome.
So now, if they can come out, tell us some of the side effects of those things, there are limitations. People that cannot use them, the dosage, the proof of effectiveness.
The prescription, yeah. Some of them just say take as much as possible.
Those things are also coming up. There are some of them that are effective. So I can't really say that some of those things are not effective. But abandoning things that have been certified to be effective for things that have not been certified.
It's against logical reasoning, yeah.
Yeah, that's that.
And we cost
now, I was talking about prostate
cancer.
Any male above the age of 45 should do just a simple test. And the truth about all this is that you may not even do all of them at the same time. You may not spend at the same time. You schedule them to different times. Take, for example, your prostate CA screening, prostate cancer. Maybe once in a year, like February. The next one you want to do for your diabetes, maybe around May. So you may not even put all the money. You may not spend all the money at about the same time. So that one will be able to pick any abnormalities on time. Now, on ourselves, we don't. If you earn 1 million today in a month, you can't spend 500,000 naira on yourself. You will give to people. That's my own personal belief. You give out, you buy for your family. This part of it is you are registering these kiddies for some trainings. They don't mind. What you can do is your health. You should be healthy for them, so that in the nearest future, everyone will be present. You understand? It will not be simple things like breast CA that one can actually pick, cervical cancer one can pick, that is causing like loss of loved ones. Are we together? So now, another important thing that people forget to really do, that is so simple. You may not even spend more than 100 naira per day. You don't even do it every day. Is your blood pressure. I'm sure, is there anyone here in the last 1 month that has not heard of someone dying without any like sickness before? Sudden death. It's a common thing. Within 2 weeks, you will hear, not only in the hospital setting, hear that someone died without any sickness, someone just died, heart attack and co. Basically, a lot of them would have elevated blood pressure without picking. Blood pressure, hypertension. It is not about, I don't have anything that I'm thinking about. No, it is not about it. It is not even about, but there's no headache now. It is not even about, because I didn't sleep overnight, if I can sleep, my blood pressure will go back to normal. There's nothing like that. It's so simple. As we age, as we wrinkle, our skin wrinkles, those things inside our body are also depreciating in their functionality. Part of it is the pipes, the vessels carrying blood. They get coated, they get lined with fats. So one way or the other, the effectiveness, their functioning is not as we were young. So that means whenever you have the opportunity, go to a nearby center, let them measure your blood pressure for you. If it is fine, the next time may be in the next 1 month. I'm sorry for that time, light out. Tosin. Okay, so let me quickly step out. Okay, now, so a lot of people will be like, I can't have hypertension. These are basic things. All right, thanks. Mumbo. Hello? Okay, all right, sorry about that. Now, other things include the blood sugar that I talked about. When you check your blood sugar, maybe once in a year, it's even fine. And how much is it? It's less than 1,000 naira or 1,000. People in Lagos, maybe 1,500, thereabouts. So it's cheap. So the summary of what we have been saying is, we are moving, we wake up every day looking for our livelihood. We should not just forget that we should service ourselves. We should service our body. You service your car every day. You service like as often as possible. You don't want your car to get spoiled. You service your generator. You wouldn't want it to just go like that. So because of that, we should service ourselves. How do we do that? Your routine screening. I've talked about self-breast examination, Papa Nicola smear. For the male, we talk about prostate screening, which is just a simple blood test. We also talked about checking your testicles for pain or for any abnormality that you can actually pick. Then overall, your blood sugar, and of course, the blood pressure are things that we should do.
Thank you very much. It's 6 p.m. and I don't want to take your time further. So let's take this. We have some questions in the chat box. If you have questions, feel free to type them in the chat box concerning women, healthcare, fertility, sexual health, test, anything concerning medicine and her field. Do let us know in the chat box so she can answer before we say goodbye. So pertaining to taking vaccines for cervical cancer, how many dosages is it and the cost? Did you hear that, doctor?
Okay. Concerning what?
Vaccines for cervical cancer.
Okay.
How many
Okay. Okay.
dosage?
Okay. Now.
Prescription.
All right. Now, for the pap smear, which is the screening test, it depends. When you do it and everything is normal, the next appointment is 3 years.
Okay.
And you see that that's very easy. When you do it and the result is very fine, the next appointment is 3 years. But sometimes when there is like an infection or you need to repeat it, they may need to like cross-check again, 6 months. But if everything is fine, it is 3 years. But since this person is talking about dose, I will quickly mention something. Now, where we have dose is when we are talking about the vaccination. There is a vaccination against development of cervical cancer. Although the age group is our kids. We'll be talking about age group 9 to like 12 years for both boys and girls. So if you have the opportunity to give the vaccination to them, very good. And it is just about 2 doses or 3 doses, depending on the brand. So that's that for the pap smear and cervical cancer. Can I just go through some of the questions by myself so that it'll be faster?
Okay, okay. My screen, I copied the screen. You may not see them because most of them are comment. Can you see my screen?
Okay. And
can you see my screen? Okay. Yeah, that's the second question. Right. Please mention some checkup that should be done regularly.
Very good. Now, we have talked about checking your blood pressure that determines hypertension, your blood sugar that determines diabetes. It is also very good to check for the kidneys. You know, before you say anything now, chronic kidney disease, soliciting for 15 million, chronic kidney disease up and down. You check your kidney functions. And if it is very good, the next time may even be in the next 1 or 2 years. It is so easy like that. Other checkup could include for people older than 40 years, we can talk about our heart, which is the ECG. ECG, especially just say ECG, especially if you have hypertension or even family history of hypertension, ECG. So basically, these tests are very okay. These are basic things that we can do. So someone was asking about how do we clean our blood vessels? So now these are some of the Instagram, like, I don't know how to say it. There are a lot of vendors there. What they are after is just to dissuade people from the right path. Now, there's nothing like cleaning your blood vessels. You don't need to clean your blood vessels. If you can maintain healthy lifestyle, you check your blood pressure, you check your diabetes, blood sugar, you exercise regularly. That's another important thing to take. Regular exercise is very good. Whether you are of normal weight, just like our tutor, or overweight like someone like us, everyone needs to exercise regularly. It's just a normal way of life. It's not about being overweight before you start exercising. So when you exercise, your blood vessels will be cleaned. There's no need to use any products, any specific drug, capsules, even orthodox drug for that purpose. If you have diabetes, use your drug regularly. If you have hypertension, attend your clinic, go for your follow-up appointments, use your drugs as they have been prescribed. Never discontinue your drugs without your doctor's permission or consent. So that one will take us to the next question about multivite. Is it recommended to take multivite? And if yes, can you recommend a good one? The truth of the matter is you don't really need any drug every day. When you eat balanced diet, you are good to go. When you exercise regularly, you are good to go. When you take your medications, if you have been placed on drugs, if you have hypertension, use your drugs. If you have diabetes, use your drug. If you are a sickle cell patient, use your drugs. If you're not in that group of people that need multivitamins, you don't need them. Because the truth of the matter is we are not going to lie to you. There's nothing without side effects. Even paracetamol has its own side effect. Excessive vitamin C has side effects. Excessive everything has side effects. So I'm not going to recommend any multivitamin to you. What I'm going to say is that exercise regularly. If you have clinic appointments, go. Check your blood pressure as often as it is necessary. Check your blood sugar as it should be, and be fine. Be fine. As middle-aged people, I'm sure that maybe younger age group may not be here, but middle-aged people, or even people younger than that, it should healthy lifestyle. Healthy lifestyle. You should not be taking alcohol. You should not smoke. These are basic things. It's not about being religious about it. All those things are not good for one's health, every part of the body. In fact, recently we discovered that most of the problems we are having with infertility, I can categorically say it that in the last couple of years, male have been the problem. Before now, when anything happens in the family, there is difficulty in getting pregnant, they will be like, it's the female, it's the lady, she should go to the hospital. The male will be doing like...
Doctor, are you there? Doctor?
No, we discovered the males now, they're having...
Unmute your mic, doctor. It seems your mic is muted. Yes, we can hear you now.
All right, thank you. A call came in, that was the reason.
Okay.
So now, it's about our lifestyle. Why would someone be having pain, be having like discomfort, and you are not going to the hospital? I saw someone that's been passing blood through the anus for the past 2 years, and the person kept taking herbs, kept taking Opayin, Alemo, Yafato. They kept telling him that is jedi or something. I call jedi, different types of jedi. And this thing is most likely a colon cancer. I'm telling you, it's likely to be intestinal cancer that the guy is having. Look at that. So as much as we do some basic things that is based on our society, what we know the society to be like, we should also like rethink about what could be the implication of all these things. What could be the implication of not following your doctor's opinion sometimes? So sincerely, we don't need any multivitamin. What is the maximum or the minimum blood pressure or blood sugar level can someone have? Okay, now the blood pressure will depend on your age. And of course, we also depend on some other condition, like if you have diabetes. If you have diabetes, your blood pressure should be lower than someone without diabetes. Now, younger people, they have lower blood pressure than the older people. But the minimum is like 90-60, it's usually 2 values. The upper, which is the systolic, and the lower, which is the diastolic. So we have 90-60. That's the minimum. Anything lower than that is hypotension. And it kills faster than hypertension. It kills faster. That is when someone will just collapse, or someone will be bleeding after accident or after delivery and they will die from hypertension because the blood pressure is too low. It kills faster. The maximum is 140/90 for anybody. No one should have above greater than or equal to 140/90 systolic, diastolic. So these are the range. Now, look at this blood sugar. Blood sugar too, there are two major types. We have the fasting value and the random value. The random value is anyone that you do at any time, irrespective of your last food. The fasting is the one you have eaten in the last, you have not eaten in the last 8 hours. So it all depends. Like we have 120 milligram per DL, you don't really need the value. But the most important thing, when you go to the lab, when they check, they will give you the normal range. You can see if your value is within the normal range. I hope we can get that. All right. Okay, I think that's about the questions here.
Thank you, doctor. It seems there is another question. Thank you. Okay, thank you. What about blood tonics? I remember back then, whenever I come back from my boarding house school, my mother would say, look how lean you are. Oh, yeah, blood tonic. So would that give me blood? Would that make me fat?
There are some of these, the components, one or two of the components of multivitamin or blood tonic, they can make you eat more. They can make you have more appetite so that you will be able to gain weight before you return back to school. You understand? So that's why they say if I take tonic and coke. But sometimes, as I've said, if you eat well, there's no need for any supplement.
Thank you very much. We're really, really, really grateful. So for those of you who would like to follow Ma'am, let me give you the details here on another page. Follow right now. She's really, really doing well. And we're working on her book already. And Adeniro Muibat on Facebook. She shares amazing videos. Adeniro Muibat. Is Adeniro Muibat as well on YouTube, right?
Yes.
And on Instagram, Dr. What?
M.A. Adeniro.
Adeniro on Instagram. So TikTok, Dr. M.A. Adeniro as well?
Yes, sir.
Okay, good. Instagram and TikTok. Feel free to follow her for more professional recommendations and pieces of advice. So for those of you who want to ask questions concerning the first session, it's almost time for our group here.
All right. Can I be excused, sir?
Yes, I know you're busy. Thank you. We're really very grateful. They also thank you in the chat box. You can check.
Yeah.
Okay, don't worry. There are many Adeniros on Facebook. Don't worry. I'll send the link to you in the WhatsApp group so you can just click.
All right. Thank you, sir.
All right. Thank you for joining us, Doctor. Thank you. We're really, really grateful. All right, so that's the end of the sessions. It's good to have all of you, and I'll try to have more. What do you think? Ma'am Muibat is not here anymore. Did you enjoy this? Would you like to have something like this, medicine? Another person comes, talk about psychology, talk about child growth, motherhood, experts, not just ordinary people. Would you like this? Let me know in the chat box. This is the first time we're having this, so we want the feedback. Would you like this? Very well. Would love to have more of this. Yes, Twitter. Good. No problem. We're going to. So if you have questions concerning the marketing, the first session, feel free to send them on the WhatsApp group because this is 6:16. There are many other things to do, and we've spent more than an hour. So this. Okay, I'll send the link to her social media handles to you on the WhatsApp group. So you just click on the link and you get there immediately. It's good to have all of you. Thank you so much for being here with me. 1 year online kiddie school, it's a year old. And I am glad to have you all as part of our success story. Thank you very much. So when your kids come here, when we finish our session, I allow them to mute the microphone and we all shout. I know you're all, you're all babas and mamas, so you may not feel convenient shouting. So you may just say anything like goodbye, thank you. So we say success at your fingertips a lot. Thank you so much. Yes, she is, Mom Sekina, gynecologist. Yes, she is. Okay, I want to ask you to mute. Good. Before we say goodbye, I haven't stopped recording. So for those of you who want the recording, I'm going to send that to the